Abuse and Illicit Trafficking, a Public Health Perspective. Drug abuse is not just a personal problem, it's a public health crisis. Every year, millions. Illicit trafficking fuels this crisis. It's a global black market that knows no borders. It thrives on corruption, violence, and exploitation. It not only finances organized crime and terrorism, but also undermines laws, order, and the safety of our youth. This seminar brings together experts, health professionals, policymakers, and advocates to discuss one of the most pressing public health challenges of our time, substance abuse and drug trafficking. We aim to explore prevention strategies, recovery support, and international collaboration to combat these global issues. With this short intro, I'd like to commence my part of this seminar. This is Drug Abuse and Illicit Trafficking Public Health Perspective, organized by Department of Community Medicine, NIPSAM. We are presented by me, Dr. Foyzur Rahman, Medical Officer NIPSAM, and Dr. Zaki Alam, Lecturer NIPSAM. Brief history. The International Day Against Drug Abuse and Illicit Trafficking observed annually on June 26, established by the UN General Assembly 1987 to combat drug abuse and trafficking. The day commemorates Lin Jexa's 1894 to dismantle the opium trade in China. The observance was proposed at the Vienna International Conference on Drug Abuse and Illicit Trafficking in 1987. The two key texts on drug control were adopted. In the context of these topics, we have to know about the drugs. Drug is any substance that has physiological effects when introduced into the body. It can be used to medical purposes such as treating diseases or for recreational use, often leading to addiction. Drugs can be classified into different categories. Medicinal drugs used to diagnose, treat, or prevent illness. Psychoactive drugs affect the central nervous system, altering mood or perception. Illegal drugs, substance banned due to their harmful effects and potential for abuse. Now we want to know about drug abuse. Refers to pattern of drug use that involves taking a substance in amounts or with methods that are harmful to the individual or others. It often leads to tolerance, requiring high doses, and withdrawal symptoms when stopped. Abuse disrupts daily life, affecting cognitive function, compulsion, mood, and social interactions. Long-term consequences include health issues like organ damage, overdose, mental health struggles, depression, mood swings, and social costs, legal trouble, financial instability, strained relationships. Due to its broader scope, the term substance abuse is now used instead of drug abuse. And which is illicit drug trafficking? Drug use and its impact. Global drug use disorders, 64 million, only 1 in 11 receives treatment. Injecting drug use and infectious disease, 1.6 million have HIV, 1.4 million both HIV and hepatitis C, and 6.8 million hepatitis C alone. Drug use and its impact. We will see previously cocaine production reached a record 2,757 tonnes in 2020, a 20% increase from the previous year. Increased violence and health issues along the supply chain, especially in Ecuador and Caribbean. Drug use disorders in the United States, 5.3 million widespread addiction. 2010s, a crackdown of prescription pushed many users toward heroin, increasing overdose deaths. Rise of synthetic opioids like fentanyl, which is 50 to 100 times more potent than heroin, became the leading cause. 2.3 million American 12 or older, 0.8% suffered from stimulant use disorders. Crisis in North America. The opioid crisis in North America has evolved into a severe public health. There is a case study. Addicted son hacked to death by father in Gazipur. It is published in. It occurred in 3rd April 2024, Wednesday. A drug-addicted young man was allegedly hacked to death by his father in Gazipur, Kaliganj, Upazila. The incident took place in Jamalpur area. The deceased was Kausar Bagma, 23 years of age, son of Rashid Bagma, a resident of that area. According to police and locals, Kausar often vandalized the furniture in the house if he didn't get money from his parents for taking drugs. Besides, he behaved badly with his parents. His parents were fed up with his torture. On Wednesday, his father hacked him to death with an axe while he was sleeping early in the morning. Muslima Begum, mother of the dead, said Kausar was a drug addict. He often pressured his father for money to take drugs. Last night, he pressured his father to sell a lamb and demanded money. As I didn't agree to pay, he beat me and threw me out of the house. In this incident, his father hacked him to death with an axe while he was sleeping. Aliganj police station officers in charge, O.C. Mahatabuddin said, Rashid Bagmar, the father of the dead, has been arrested in this incident. The body was recovered and sent to Shahid Tajuddin Ahmed Medical College Hospital, morgue, for autopsy. Legal action in this regard is under process, application. This is a real life picture in our country, how drug abuse is affected. And this is all from my part today. I would like to invite Dr. Jaki Alon to present the rest of the part, and we'll see how the drug is trafficking illegally in various parts of the world. Jaki Alon.